Hello, I am Dr. Cindy Rubin. I am owner and founder of In Touch Pediatrics and Lactation, which is a small home visit lactation and general pediatrics practice outside Chicago in the western suburbs. And this is Keeping in Touch, a weekly YouTube show and podcast that has usually a renowned guest to interview. This week, you just get me, and we will be talking today about the ins and outs and the do's and don'ts of treating plug ducts and mastitis along the new guidelines, which are quite different from what we used to recommend. And truly, it really takes a change of mindset to buy into these new recommendations and make sure that we treat accordingly and prevent some serious complications that can come about with plug ducts and mastitis. So, to start, I'm just going to describe our old recommendations and what we used to do and why, and then discuss a little bit about the process of what is truly going on when we get a plug duct and mastitis. And then hopefully it will make more sense when I explain how we actually recommend going ahead with caring for it so that it doesn't advance to anything worse. So, what we used to recommend, and this was based on the idea that a plug duct is essentially like a clot of milk that has developed in the breast in a duct that has formed because the milk's just been sitting there too long and it's gotten thick and clumpy and it can't move its way through. And so what we used to recommend was warmth, like warm compresses on the breast to kind of loosen things up and help with flow. And then really mashing on the breast and trying to push that clot through the duct, clear it, and get it out. And those were kind of the main things that we recommended, as well as just nursing, or pumping, and pumping extra. Like if your baby seems to not be emptying your breast, then you need to pump also until you empty your breast. So this was what made sense based on what we thought was going on. What we have learned is that actually what is going on is inflammation in your breast, and that inflammation can lead to what we call plug ducts, mastitis, which can be just inflammation, but could also progress to infection, as well as some other things that can be related, like nipple blebs and chronic breast pain, or something we call mammary dysbiosis, or a subacute mastitis, which happens when our breast flora, the bacteria that live naturally in our breast, get a little bit out of balance. And that plus overproduction, or our breasts getting really full and being more full than they can really handle for prolonged periods of time, can lead to this chronic inflammation that just comes back again and again. And what happens when you get this inflammation is that the tissues of the breast around the ducts get swollen and they push on the ducts so that the ducts are narrowed, and all of the blood vessels and the lymphatic vessels that drain the inflammation get pushed on also, and things cannot drain well, blood flow doesn't go through well. And all of these things happen that then contribute to more inflammation. And then there can be inflammation within the ducts as well that just continues to narrow the ducts so that milk can't get through. And when that happens, then we get these areas that specifically can be more tender, can feel engorged and sometimes can feel like a fairly discrete lump or area that is really swollen. And we may notice decreased milk because there's not milk getting through, but it's not because of inherently having a plug that can't go through a duct. It's because of the inflammation that narrows the duct to the point where it may become completely obstructed, and then the milk behind it can't get through. So it's just a little bit of a different way of thinking about things so that you can see that the treatment really is not pushing a plug out, even though there can be a little bit of thickened, congealed milk behind that obstruction that does form. But really, it's treating the underlying inflammation, because whenever we have problems in general, we may treat the symptoms, but really we need to treat the underlying cause or process that's going on, or else it's just going to keep happening again and again. We may treat it symptomatically, temporarily, but it will come back again and again. So, how do we do this? So, as opposed to warmth and mashing and emptying our breast, emptying our breast, emptying our breast, what we want to do is create a situation where our body will regulate the amount of milk we are producing to match our baby's needs. We don't want to artificially produce more milk by thinking that we need to empty our breast more than we really need to. That's one. The other thing is using a combination of tools that can help decrease inflammation. And we decrease inflammation in the breast just like we would decrease inflammation when we have a sprained ankle or something like that. And that is with rest. So when you have a sprained ankle, you go on crutches or you sit there with your leg elevated and you don't go out and do the sports and running around and putting stress on your ankle, because that's just going to make it worse, right? So same thing with the breast. We don't want to be mashing and causing extra trauma to our breast, which can just cause more inflammation and more trauma to the ducts, and it just does not allow things to rest and heal. So as opposed to mashing, we want to actually be more or less hands off, aside from one specific type of massage that we're going to talk about in a minute. Another key to decreasing inflammation is ice. So rather than heat, which at times might feel a little bit okay, and it's okay to use warmth in certain situations, but generally we want to use ice or cold compresses, a pack of frozen peas wrapped in a towel and kind of sitting on your breast can be very helpful. And that calms down inflammation quite a bit and can feel really good and soothing on warm, hot, swollen breasts. Another thing is medications that decrease inflammation. So a specific class of medications called NSAIDs, or nonsteroidal anti-inflammatory drugs. The key one that we use most frequently is ibuprofen, can be very, very useful when these things are happening to control the inflammation and decrease it. Now, before starting any sort of medications, you want to touch base with your own physician to make sure that it is safe for you. If you are aware for any reason that it is not safe for you to take something like ibuprofen or the class of medicines, then do not start it without the okay from your physician. And you may need to do an alternative. Tylenol or acetaminophen is an alternative, but it's not specifically anti-inflammatory, but it is pain control and it can still help in these situations. So you can sometimes use acetaminophen either in addition to or instead of ibuprofen in certain situations when it's extreme or when you can't take ibuprofen. Next is the gentle massage that we were talking about. And I want to show you what this is. But the idea is that we've got all this inflammation developing in our breast, and we just simply need to allow it to drain. And that inflammation and that engorgement and our breast being full is part of the natural process. So there's always going to be some amount of fullness of our breasts if we're making an adequate production of milk, because our babies are not always going to eat right on time, or they're going to start going longer stretches in between when your baby is nursing, and they may be sleeping through the night. In the very beginning of lactation, when your milk traditionally comes in, it often will come in pretty large amounts, more than your baby needs, and you will get engorged, both from milk as well as increased blood flow and soft tissue swelling that naturally happens during those times. And when that happens, we do recommend regular breastfeeding, nursing, or pumping if you need to, or hand expression to relieve that swelling and to express milk so that there will be decreased fullness and inflammation. But we don't necessarily want to empty our breasts more than what our baby really needs, because we have to find a balance between not letting our breasts stay super full, uncomfortable, tight, engorged, warm for too long, because the inflammation builds up and that can lead to plugged ducts and mastitis. But we also don't want to empty our breasts when our baby wouldn't naturally be emptying our breasts, because your baby should be taking off the amount that they need to give your breasts, your body, the signals to figure out how much your baby needs and to regulate down or up to match the demands of your baby. So anytime your breast is emptied, you start giving your body the message that it needs to make more milk. And you also give that message when your breasts are partially emptied. But if you completely empty, then your body's going to go into even more like rev it up. Let's make more. Let's make more. And what can happen if your baby's not going to be emptying because they're not eating that much is that they're never going to be able to empty your breast. Or if you're pumping the amount that your baby is eating, your breast won't get emptied. You have to let there be some period of time where your breasts are staying somewhat full so that your body gets the message that it needs to bring it down a little bit. So hopefully that makes sense. What happens is if we feel or take those old messages that you need to empty your breast. So anytime your baby doesn't empty your breast, you're at risk and you need to start pumping more. So every time your baby eats, let's say they eat 3 ounces, you may not know exactly how much they took if they're eating at the breast, but they ate, you still feel a little bit softer, but kind of full still. Oh boy, I need to pump, get the rest of that out. Not necessarily, because when you do that, you're going to tell your breasts, oh, my baby actually needed 6 ounces or however much you ended up emptying, the pump plus your baby, and your breasts will continually want to make that amount. Whereas if we leave things a little bit full, or let's say your baby empties partially, your breasts are a little bit full, then your body starts to know, oh, we didn't need to make that huge amount. We're going to start making a little bit less and a little less. And we need to trust the process. I think we get really, really worried and scared anytime our breasts are not emptied that we're going to have a problem come up. And we need to trust that there has to be that balance. Now, that being said, if your breasts are starting to feel full and uncomfortable, you don't want to let them be super full, engorged, starting to get warm, painful for a long time. So if your baby is going longer, let's say between nursing sessions at night or during the day, or your body's starting to make 6 ounces when your baby's only eating 3 ounces. So your baby only empties 3 ounces, you don't pump, but then before your baby's due to eat again, you start feeling really full because your breasts are again making more milk when they didn't need to. But it's only by letting those breasts stay full a little longer that our body will start to bring that down, so it doesn't just keep happening again and again. So what you can do when you're getting super full and uncomfortable is a little bit of either hand expression or pumping. Or nursing, if you could do just a teeny bit of nursing, potentially like a dream feed, to just take a little bit of that pressure off, get a little of that inflammation off while still giving your body the message you don't have to make tons more milk right now. Just hang on, wait until the baby needs to eat to start making a little more milk. And that over time, if we trust that process and continue to do the ibuprofen, not pushing, not mashing, do ice, all those things, then our body will regulate and start making the appropriate amount of milk, and there will be less and less inflammation over time and less chance of those plug ducts coming up or mastitis and all the complications that go along with it. So sorry, I got a little off track there. I wanted to show you that drainage process, that gentle massage that can be very helpful in these situations. And this is something called lymphatic massage. I'm going to demonstrate here. This is something that has kind of been brought to the forefront by a breastfeeding medicine physician and also a breast surgeon out in California named Katrina Mitchell. And she works with a lot of breast cancer patients, and those patients also get swelling and engorgement in their arms and breast, chest area during or after breast surgery for cancer. You can have backup of a lot of inflammation as well and trouble with draining that through. It can be very uncomfortable. And so you need to help your body to be able to drain that excess inflammation and fluid, just like with these lactation issues. So what you want to do, you can do this often throughout the day when you're having active issues or discomfort, is first you prime the pump. So we have these pathways that our bodies drain toxins, infection, inflammation out through certain roadways in our body. And the drainage for the breast is going to be out through the armpit. So as opposed to mashing hard and traumatizing the breast and pushing things out towards the nipple, we actually want to draw that milk away from the nipple and from the breast and where all the inflammation is up towards the armpit. So we start by opening up those tunnels, the drain pipe essentially, which is up through the armpit and the shoulder. And so finding this area that is in the soft part above the collarbone, kind of next to our neck here, and doing 10 kind of light pressure, gentle circles in a row here starts to just kind of open that up so that things are going to be able to drain. So about 10 circles here. And then same thing here in the armpit, kind of towards the breast a little bit. 10 circular motions here. Once you do that, then you've kind of opened up the drain and you can start helping to move all that inflammation gently from your breast up towards the armpit. So these kind of gentle sweeping, petting motions, really not more firm or more pressure than you would give your cat if you're petting a cat. I'm gonna have my little breast model here to show you too. So gentle sweeping motions, and you can focus a little bit on areas that maybe are more engorged or more inflamed, but you're not going to be mashing on those areas. You're just going to be pushing the fluid that's behind it out towards the armpit. And you can go under the breast and around, and you can go over on both sides. That's kind of classic lymphatic drainage massage. There's also other things that can just help to loosen everything up and help that inflammation to resolve. Just lifting gently. I don't know if you can see this, lifting your breast just gently off of the chest wall, just very gently, kind of opens up the roadways that are kind of back against the chest wall so that things can drain. You can do that before you nurse or when you're feeling really engorged. Also, sometimes this light tapping all the way around your breast, or those little circles, kind of like what we did up here, but on the breast. Very, very gentle. This can make a big difference. And doing this right before you are going to nurse or do pumping or anything like that can really help to decrease that inflammation, so that then when you nurse, the milk is going to flow a little bit more easily. Sometimes, especially in people who pump, we often get a lot of swelling, especially if our pump flanges are not sized right. We can get a lot of swelling and inflammation right around the nipple. And so focusing on this area to relieve some of that inflammation, sometimes just kind of gently pressing down back towards the chest wall, pressing down around the nipple and the areola can help to decrease some of that inflammation. That's also called reverse pressure softening, and is something that if you're feeling very, very full and engorged to the point where your nipple's almost disappearing there and your baby's having trouble latching because of so much swelling here, then that reverse pressure softening can help as well. Sorry, I'm having trouble getting this into the vision of the camera. So that is something that you can do many times throughout the day, as many as needed. I would say if you're prone to having plugged ducts and mastitis, you may want to just baseline do it 3 times a day, before bedtime, in the morning when you wake up, sometime in the middle of the day. And when you actively have a plugged duct or mastitis or nipple blebs or chronic breast pain, or you've been diagnosed with subacute mastitis or mammary dysbiosis, then you actually want to do it more frequently. So perhaps before and or after every time that you nurse or pump. Now, of course, we can't do this all day long, so you have to pick your battles and do it when you can. But as frequently as you do it, especially when you have symptoms, will be very, very helpful. You can do it 5 to 10 minutes. You don't have to do it for really long periods of time. And if occasionally you can only do it for a minute, that's better than nothing. So it may seem weird, like, oh my gosh, I'm just patting my chest. What? This isn't doing anything. Right after you do it, you may not feel that like sudden release that I know sometimes we do feel when we're mashing, mashing, mashing. But that release is going to be temporary. And we need to trust that if we let our bodies down regulate, we get rid of that inflammation, then it will improve and it will not continue and recur and recur and recur and turn into something worse. I had a patient once ask me, I used to get my last pregnancy, I got so many mastitises, I got a breast abscess. I'm so afraid this is going to happen again. Can you guarantee that this isn't going to happen if I follow these directions? And I said, look, I cannot promise anything. There is going to be some amount of engorgement. There is going to be some amount of emotional, stuff going on that might make it even hard for you to follow these instructions all the time. And, I cannot promise that we're not going to get into a situation where there is too much inflammation and something pops up. But if when it does, take a deep breath, follow these instructions, really, really just try not to do those things that we know are going to hurt things, like mashing and lots of heat and those vibrators, like anything like that is going to be traumatic. And so if you avoid that and avoid the over pumping, over emptying of the breast beyond what is similar to what your baby is taking out, it should get under control and not progress to any of the real bad stuff and not continue to recur. So you got to trust that. I know it's hard and you shouldn't have to do this alone. I'm throwing out a lot of things that can help, but you may really need the help and support of a lactation consultant or a breastfeeding medicine physician to go through your whole situation and make sure you're doing all the things that can help, because there may be things in addition to just what I've told you today. There may be some medications or herbs that can help with lowering production safely. There could be antibiotics that are occasionally needed for one reason or another. One caveat to the ice and cold that I was talking about is sometimes people can have vasospasm of the nipples that can cause a sharp pain with nursing or pumping while you're nursing and pumping. I don't want you to self-diagnose that, but if you have that, then actually warmth usually helps and ice can trigger it. So, especially in that sort of situation, you can still use ice, but you're going to use it around the breast, not straight on the nipple. And you may even use a little heat right on the nipples to relieve the vasospasm. So, that's why it could be helpful to not do all of this on your own. This is not medical advice. This is discussion of recommendations. This should not be considered specific medical advice geared towards you. So, please reach out to a breastfeeding knowledgeable physician and get help with this if you're suffering from a problem, or if you had these problems with a previous lactation experience and you're going to be having another child and you want to lactate again, reach out to somebody prenatally so we can counsel you through it and come up with a plan for when the baby comes so that we don't get into that same vicious cycle that we had last time. So you can do it. I know it can be hard, and there's a lot of mental health stuff at play that can be going on. So we need to pay attention to that and accept that it could be there, and we may need help with that to get us through as well, with some therapy or other sorts of mental health supports. So don't be afraid to reach out for that as well. So I hope this has been helpful. You can contact me with questions. You can reach out to me if you're in the Chicagoland area or even Illinois for virtual breastfeeding medicine consults. You can also contact me if you are looking for help finding a breastfeeding medicine physician in your area. And I will put links to help you find physicians that do this on the notes from in the YouTube channel. So thank you for joining me this week on Keeping in Touch, and we will see you